Hello, Brandon Mako here, and I'm here to do a review of this D3 Ultra handheld double-ended ultrasound probe. And I'm going to tell you my experiences. I've been using it since about November or December, and I'm going to be comparing it to my Clarius. I'm a musculoskeletal sonographer, and I already had an ultrasound unit, so you might wonder why I bought a second one. Well, one, I'm also an educator, so I wanted to get some more information. Are these Chinese ultrasounds any good? Because this is part of the newer generation. The old generation of Chinese handheld ultrasounds were typically 128 elements, maybe sometimes 196 elements, but typically 128 elements and 32 channels. And this is 196 elements and 64 channels. Now, and what it also does is it also allows me to expand what I can do. So this Clarius is great for superficial structures, but things like the hip, it's not so great. And this, because of the double-ended, I can now do, for example, I just had a baby born very recently, and as she was growing, I was able to look and watch her wave, and watch her hide her face, and watch her kick, which is so cool. And of course, I've practiced the emergency scans for fluid, like the eFAST exams and things like that, and things like checking for AAAs, abdominal aortic aneurysms, which is a very easy thing to check, and now I have the capability to do so. So I'm happy I got this. And so anyway, I'm going to go through and I'm going to scan a number of structures one to one. For structures where this isn't good at, I'll just scan with this. Okay, it's now, the current name is the D3 Ultra. But they used to call it the D2H, and that's what it was called when I bought it. I was using a coupon code before for that price, but even so, the price has gone up. And that's the way things are. Prices go up, prices don't go down. So let's go through some of the specs for this unit. So if we go to detail here, right, we have a convex, linear, and phased. So how they do the phased or the sector probe is it's basically just part of the convex probe, right? You turn off the elements, left and right of center, and you just focus on some of the elements in the center of the curvilinear portion, and you can basically turn any curvilinear into a phased array or a sector probe. But keep in mind you're limiting your capabilities when you limit how many elements you are going to be using. So there are limitations to its phased mode or sector probe mode. It is nowhere close to as good as the convex or curvilinear mode, nowhere close to as good images. And in terms of the frequencies, they do have a typo here. The convex, it's 3.2 to I think 5 megahertz are the two settings. Linear is 7.5 or 10, and I think they have it correct for the phased array. And scanning depth, linear, it is 40 milliliters, 40 millimeters, whereas my Clarius is 50. And I do like the Clarius because it has a little bit more width to the image, but you get what you get. And of course, this has all the B mode, color Doppler, M mode, power Doppler, pulse wave Doppler, has all the modes you could want. As I mentioned, 192 elements, 64 channels. The measurements. Now, you have to be careful with your presets because not all presets give you access to all the measurements. But key measurements, really what you need to measure cross-sectional area, you need to measure, point to point or an angle. Definitely has those pretty much with any setting. You can take that type of measurement. So, and then in my mind, that's the most important stuff. Has puncture assist. I haven't used this myself. And to compare with the Clarius, you don't need a subscription for using this, and you get basically all the settings, everything available to you without a subscription. But and you have more control. The Clarius is auto everything. You don't have control over, for example, your focus points. And here you do have control over your focus points. Here you do have control of your frequency. So I have more control. But there's set values. I can't set the frequency to everything I want. It's only the two presets. The focus, you just press the focus and it cycles through pre-selected focus points. So you can't move the focus to exactly where you want. So there are limitations to how you can adjust the image. But that being said, you can adjust the image, which is nice. And this is great. You can export the images in basically all the formats that you can need, including DICOM without a subscription, which is nice. The battery lasts longer than the Clarius. It'll last weeks without me charging if I'm not using it much, and it'll last probably a couple hours of use. Yeah, continuous scanning time, about 2 hours. Yeah, that seems about right. The Clarius dies after about maybe 45 minutes, 30 minutes. This does not get as hot, and it does seem to last longer. Not forever, but it does last longer. Wireless charger, that is true. I haven't been able to find the app for Windows. I wish I could find it for Windows, but we have the Android, and I use the Android app, and I'll comment about how it works, and you can just find it on the Android store. I assume the same for the iOS store. This is Wi-Fi connected, and it's extremely fast to connect and get going. So fast to connect and get going. In fact, just off screen, I looked at my video of me using this, and I counted. It's exactly 20 seconds from turning it on to starting to being able to use it. So that's how fast it is to be able to use this. It's Wi-Fi. Clarius requires Bluetooth at the same time. This is just Wi-Fi. It's sealed, so there's no cable, so you can't connect this by cable. Some people consider that a pro or con. The fact that there's no cables means this is entirely sealed. There's no opening for you to get water inside. So I consider that probably a pro. With a long battery life, I consider it pretty good. It is a little tricky to hold, I must say, and the button placement being asymmetric makes one way of holding it much better than the other. Okay, yeah, dimensions, it's 263 grams. So even though it's a double-ended probe, it's about the same weight as the Clarius. It's about the same weight. I don't consider this too much weight. Again, the awkwardness comes with the button placement if you want to pause or freeze the image. It's a little tricky to press the button. So I do find, whereas the Clarius, I can press the button just fine. With this, I need to have my tablet close by to use the freeze on the screen, or my phone close by to use the freeze on the screen, because sometimes the button is just too awkward to press. And your hands can get slippery with gel, and I'm getting better at using the button. And if you're using the curvilinear side, the button is perfectly placed. Right, so because it's right next to there, so your hand is right there. But if you're working on this side, now it's way up there, and so your hand is down here. It's just not ideal. And storage, it stores the images locally, and then you can take the images. There is one type of image, which again, I've mentioned the app is a little buggy so split screen images. You try to take a picture of a split screen image and it doesn't save. So I end up having to print screen all the other pictures, save fine to local storage. Unlike the Clarius, where if you don't pay the subscription, you can't even save the images locally. Which is just crazy to me. What's in the package? You tell them what type of plug you want. So you get the plug, you get a charger, you get the unit, you get a little quick start guide, and away you go. And you download the app and you start using it. So you can see this price here, $2,660. That's different from the $2,800. There's always a discount of some sort. There's always a coupon code, right? It says auto 5% off at checkout. Sometimes it says, 10% coupon code used now. So keep an eye out for coupon codes. They do have some sample images here, but again, I'm going to go through a whole bunch of sample structures on myself and sort of also compare side by side with the Clarius, so you can see. But these are fairly representative of what you can see. Notice there's not a lot of tendons here, because I find tendons without compound imaging, tendons are really hard to nail down or to get a nice picture of. So they picked structures that you can get a nice image of. The cartilage, the liver, right? The arteries. It's a really easy to image structures, and they always look really nice. So this is a little misleading, but you'll see real world what it can do. Let's go through what they say here. As I meant, built-in remote Wi-Fi connectivity. Yep, you just start it up. You open the app. You then, from the app, you click a little button there, and you connect it to the unit's Wi-Fi, and away you go. You start scanning. I'll tell you, there are ways of doing this wrong though. The app is a little bit buggy that the everything just basically locks up. Again, I'll cover under what conditions that happens and how to fix it if it does happen. Because one time I had to delete the app, re-download it, delete it, re-download it. Use the transducer with a different tablet, a different phone, just to try to get to start to work again. So I don't want you to run into that headache. It does have all these presets, and as I mentioned, sometimes there's different measurements within the presets. And the presets, it tells you all the settings that's using. Now, aside from the measurement differences, you can make any preset. You can press all these buttons to change from any preset to basically anything you want, right? Because you have the control over everything that changes with the preset, except for what measurements you have access to. That seems to be the only thing you're sort of stuck with. 5 scan modes with pulse wave up. As I mentioned, this has every mode that you could basically want. It's great. In terms of options, right? 27 on-screen measurements, as I've mentioned. Not all of them are available in all presets. One-click freeze. Yeah, just press the button on the unit and it freezes, which is very convenient. You can press this button here to use split screen, which is just great for comparing with normal, or for compared for normal and educating the patient about what's going on, or comparing one side to the other. I love split screen. As I mentioned, you can't save split screen with the app at the moment. Very long cinema clips. It's set for 100 frames here, but you can set this up to, I think, 1,000, which is super, super, super long. Which is great. So, more features is good. More options is good. Again, I haven't used the puncture assist function. As I mentioned, it will do DICOM and local storage without subscription fees. So crazy that Clarius asks for a subscription just to save locally. But yeah, so in DICOM format as well, if you want. Again, you can put your notes in if you want. You can. You just have one box basically to add in your notes, and you can do that. As I mentioned, extra long cinema loops. Okay, let's talk about the unit and let's talk about the app before we get to all the images. Again, there'll be timestamps in the description if you want to jump straight to the images. But you can see on the linear side how this is about 4 centimeters long, whereas the Clarius is about 5 centimeters long. You can see their relative size. They're about the same weight or close, so close I can't really tell the difference between them. Maybe this is a little bit lighter, but I really can't tell for certain. We'll get the whole size in the image here. You can see they're about the same size. You can see the buttons on the Clarius, which are here and here. I know it's on black, but there's 2 buttons, and one can be programmed. I think one's always freeze. So freeze and take pictures, how I had it coordinated or set in the app before the app deleted my settings. Thanks, Clarius. There is a button here on this dual-ended probe, and just tapping it will freeze the image. Holding down will switch from the linear side to the curvilinear side. And you have to be a little bit careful, though, because if you start the app on the linear side, the app will crash 100% of the time. So, but when you first turn it on, it automatically goes to curvilinear. So unless you hold it and switch it to linear and then go into the app, you're not going to run into that issue. And then, well, to fix it, you just make sure it's in curvilinear before starting the app. And I've also I'm scared to try it because it was really difficult to undo, involved multiple Android phones and tablets, and uninstalling and reinstalling, and in the end I still don't know what to fix it, so I don't want to recreate it for you. But the cardiac, I think starting it on cardiac setting will also mess it up, but you can't control that with the button. So I would not ever turn this off with it in cardiac setting. If so, again, you might have to I tried restart the program and try to switch it from cardiac to something else right away, because there's no button for it, and it was just going into its last setting, which was the cardiac setting, and then crashing. and I didn't really know how to fix it. Uninstalling, reinstalling, and in the end I still don't know why it fixed. There's a light here that gives you an idea of charge, although it's not perfect because there's 4 bars here, and one always flashes when it's on, so you know, you have a vague idea whether it's fully charged or whether it's half charge or less. But that's better than no idea at all. You can see the button placement is sort of perfect if you're using the curvilinear side. And if you're using the linear side, it feels way too long. It feels very top heavy. It doesn't feel very comfortable. I still have never figured out exactly where I like to hold it. Sometimes I'll hold it like this if I need to press the button, which is a little up high. And if I'm holding it down here, if I want to freeze, I'll either use my other hand, but then that tends to move it. What I've been doing is I try to make sure the screen is close enough I can just tap freeze on the screen. There is a code here on the transducer itself. That is the Wi-Fi password, which you need for the initial setup on your phone or your tablet. Once, of course, you've logged in and signed into a Wi-Fi, your tablet remembers the Wi-Fi password, so the subsequent times are very fast. It takes about 20 seconds from turning this on starting the app and switching over to the Wi-Fi to start scanning. So I've timed it 20 seconds, which is pretty quick. I must say I do find it slippery compared to the Clarius. I do like the rubberized grip of the Clarius. Okay, let's start this up. So I'm going to tap the button here so that it turns on. So on the curvilinear side, it's fully charged. And in the app, I will click on this here, and I will click on the Wi-Fi to connect it. And it seems like it's connecting. And basically, I can go back, and if I click here, I'm scanning. It's working. So it's that fast to get it going. If I want to turn this off, I hold down this button until the entire device turns off, and that's how to turn it off. Okay, now to go through all the features, in sort of the top right here, we have some ability to basically upload our DICOM procedures. We could select what to upload. I have not done this. So we have this button for initiating the Wi-Fi. We have this for uploading. Of course, images are also stored locally, and you can just download them the regular way from the file off of your tablet, and that's what I do. I do not use this feature. We have the patient setting here, where you can put in, name, date of birth, all that stuff, and you can have a report here with your observations. Because I've been sort of used to the Clarius not being able to save locally, not being able to upload images and things like that, I've sort of gone used to uploading images and annotating on my big computer, and I can even fix brightness and contrast and make it look nice and pretty and write a nice report. And that's what I've been doing, and putting the images basically right into the SOAP notes, and that's sort of the way I've been doing things. In particular, because although you can save images, you cannot save split screen, and I love split screen, so I end up using the print screen function to get images of split screen. Also, once you've saved an image, you can't then add annotations afterwards, so you have to freeze, add annotations right in the moment. And so I do find that it's a little limiting, where once I have the JPEG, I can do what I want. Similarly, once I have the MP4 or whatever video format it is from the Cineclip, it's easier for me to take frames out of that once I have it on my big computer and annotate. Maybe that's more work, but I end up with the images just the way I want. Whereas here, you can record a Cineclip, but in this app, you can't go through and, you can't go through old Cineclips, I should say. It's actively saving the Cineclip, so as I'm recording, you can see it's I have it set to up to 100 frames, and I can go back and scroll one frame at a time through it. I wish there was a faster way. It seems like you just have to sort of flip through. So I think you can set this number to max out at 1,000, but I see no purpose for that because that's 1,000 would be a really long time. Right, and if I want to play the active Cineclip, I can hit this button to play it, but it doesn't seem like I can pick and choose exactly what frame. I can't jump around like you can in other software. Annotation is relatively simple. There's no arrows that you can add. It's just basically text. Measurement, it depends on what your setting is. So the normal measurements are here, length, area, trace, depth, angle, area, circumference. Right, I can drag this around. I can move carefully each individual point I have selected. I like the trace. Which is quite handy and quick. If you want the special settings, you have to go into, for example, obstetrics. You'll then have access to gestational age and estimated fetal weight. If you want some of the values for velocity values, such as in pulse wave mode, you have to be in pulse wave in order to get those values, and you'll see the measurements have changed. We do have a biopsy button, which helps with interventional procedures. So in plane is quite typical, and I guess you can sort of plan out where you want to take the needle, and so you have a guide to follow. And once we freeze, we have a save button for images and a save for the Cineclip. And this gets saved locally. If you want split screen, you can't do it with full frozen. If I'm actually looking, I can press this. I can freeze this, come over here. I can take a second image. And now, we can compare, go back and forth, choose which one we want to update. And if I hit the save button, it'll look like it saves, and it'll save a blank image. I have to screen capture if I want to get an image of split screen. Now, if I want, let's say, patient information and the settings to be on the image itself, see, it just appears there briefly. I can go to preset here and click on show information, and of course, there's other things you could do, as I mentioned, change the Cineloop settings, and this information is now on the image even when I hit save. We can talk about these things, and actually we can see the effect here. So let's say I have this image. I'm currently holding the transducer over my right flank, and so this is basically Murphy's pouch, where you'd be looking for fluid, free fluid, if there was some internal bleeding or something. And let's look at how these settings change things. So I can increase the gain, which makes everything brighter. I can decrease the gain, and we can see the actual value here, makes everything less bright. Depth, you can change the depth just by swiping, but there's sort of presets for the depth, so you can't fine tune it to exactly what you want. And you cycle through these depths as you touch the depth button. Focus, if I tap this, here's the focus. It's this little arrow here. Tap, there it is now. Tap, there it is now. So it cycles through different locations. So I was looking for Murphy's pouch. That's about the right location for the focus. This button changes the dynamic range, and it cycles through. So a high dynamic range is more colors of gray, more grayscale. It's basically changing contrast. So lower dynamic range increases contrast. So I think it was around 80 or 90. That looks good. This harmonic button is the frequency. So 3.2 or 5 are the settings for the curvilinear side. Denoise, there's some denoise settings. Denoise settings, it's this ENH value here, and it just changes the number and it cycles through. So whichever one works best for you. Then we have the modes, B mode, B and M mode, which is useful for lungs, color Doppler, power Doppler, and pulse wave Doppler. The Chinese ultrasound does not come with all of the fancy features like compound imaging, which will likely be used on the Clarius, which I normally use on the Clarius. So it doesn't have things like that, or tissue harmonic imaging. So if those features are important to you, then you need a fancier ultrasound. Okay, so here's a list of the structures I'm going to go through. I think this is a pretty extensive list. I'll put timestamps in the description so you can jump around to the scans that you're interested in. Obviously, it's leaning more towards musculoskeletal. There is some point of care stuff. I include an entire eFAST exam, and it's partially explained as well. I talk with through these eFAST exam, which is why I think it's like 14 minutes long. And this is part of my trauma point of care ultrasound course, which is for free on my ultrasound educational website. Not all of my material is free, but I've made that one free because it's not my specialty, and there's lots of free resources on YouTube. So it feels weird to charge for it. But I think it's important if you have the tools for it. If you can learn and practice some of these emergency protocols, yeah, what happens if someone is injured and you have the ultrasound handy and you can check for internal bleeding? Some of these point of care scans are not complicated. AAA, abdominal aortic aneurysm, that's something easy to screen for. DVT, that is something easy to check for. Well, if you have the knowledge. So anyway, that's free. The musculoskeletal stuff on my course is not free. But yeah, I do have some other point of care. We'll do like peristernal long axis cardiac view, so you can check out how the sector probe setting works. And where possible, I will have the Clarius for comparison, but won't be possible everywhere because the Clarius is just a linear high-frequency probe. Okay, so I have it set to the thyroid, and that's what we're going to start with. I'm not sure exactly what we'll find. We're going to look at my own thyroid. I don't think I have thyroid problems, but let's throw some gel on here, and let's take a look. Oh, that's way too close, way too close. And I prefer this way. Way too close. So I'm going to zoom out here a little bit. Okay, my focus is way too high too. Yeah, that's better. That's better. Okay. So we have our carotid artery vein, right? The vein's compressible, the artery is not. We have our thyroid here, and so we just want to screen through the thyroid. And we're looking for nodules, something like that. We screen through. Oh, I have a nodule. Oh, it's tiny because it's winking in and out of existence. Right there. Skinny. So I can go back a few frames, try to find where it seems the biggest, right about there. I can take measurements, right? You want to take measurements of the dimensions, because the dimension is going to be important. So I could take a length there. I could take another length here. Of course, whenever you're trying to measure pathology, you should try to image in two planes. Like that. And of course, if I want to delete these, I can just click on them to delete them. And so I can save that image there. And let's unfreeze. So here, I'm not using the freeze button on the tablet. I do feel secure enough that I can press the button on the unit, but sometimes my hands... Anyway, so again, the awkward button positioning when using the linear side. So if I find that again, and let's move that to the center, and then let's rotate. There it is. Okay. Again, I can go frame by frame. find where it looks the best, maybe there. And again, I can measure the dimensions again. And of course, there's criteria for whether a nodule is scary or not, whether it needs to be biopsied or not. And if you have one of these ultrasounds, you can monitor your patient. I had one patient, and I was encouraging them because it was sketchy. If you follow the criteria, this is moderate risk. She should have gone for a biopsy. And anyway, so I was monitoring it, and it disappeared. It went away. We could not find it anymore. I couldn't believe it. I was like, "Are you sure you're the same person? It's not there." And it's very common to find these nodules, and most of the time they're benign, and it's fine. So I just had power Doppler on there for a moment because you should check to see if there's any changes in flow. So I just wanted to show that this unit, yes, it does have power Doppler. So here I have it on the carotid setting. And so now we have our vasculature, an artery, and a vein. Veins are collapsible, so if I give it a little squish, you will see it collapse. I could put on color Doppler. And if I monitor the size here, and move it, so I had to off screen here change the pulse repetition frequency a little bit because if it's not high enough, you get some aliasing artifacts, and even still we're getting some aliasing artifacts. But you can see that blood is flowing in different directions in both of these vessels, right? Because one's the artery and one is the vein. Let's turn that off so that frame rate gets much better. And let's put this dead center and let's rotate. Okay, so I rotate it and I have the carotid artery in long axis now. And let's turn on, sure, maybe color. And we could steer that. Here, steer it the other way. Sort of cycles through. And let's say we want pulse wave, spectral Doppler. Okay, let's take a quick look at the shoulder. So I have it on the MSK setting. Let's give that a try. There we go. I actually don't really like using this because I like compounding imaging on when I'm looking at tendons. So I do like the Clarius a lot more for this. So I'm in the bicipital groove there. And see, the biceps looks really dark, but that's just anisotropy. If I tilt that, yeah, it's bright. So it's not missing. So there's a lot of moving back and forth. You can do everything, but it's a lot of just moving back and forth. Right, again, biceps tendon looks really dark. If I tilt, it fills in though. So it's fine. The elbow outwards. Get a view of subscapularis, but again, tilt back and forth. Of course, you can look through the structures in both axes. Subscapularis looks sort of marbled because of the tendinous slips. It's tendon, muscle, tendon, muscle, tendon, muscle. And of course, supraspinatus, maybe some dynamic imaging. So look to see how that tendon should slip underneath the acromion. And I could go sort of modified Cras position. And superior facet. Yeah, looks about right. And I would notice any large tears for sure. Small tears, yeah, a little harder to see. Okay, next one is the common extensor tendon. This is what you'd look for tennis elbow. Just lateral epicondyle. You come across. And there you are. So what we're looking at here, if I can bring my cursor over, is we have, here's the footprint. Here's the ulnar collateral ligament is going to attach basically here, take up about half this footprint, and the other half will be the common extensor tendon. And what you're looking for is you can have basically an enthesitis, so an issue, basically attachment to the bone. It can be thickened, hypoechoic tendon, which would be tendinosis, not tendinitis, tendinosis. Yeah, so what I also check is, now you can also palpate for this, but I would typically just take my transducer here, keep it in the same orientation I had last time, and then I would take it and scan through the muscles, and I would look for really deep, dark hypoechoic sections, which would indicate a myofascial trigger point. Next, let's look at the wrist for carpal tunnel syndrome. So what I can do is we'll basically just look for the nerve, and we'll measure the size of the nerve. If the cross-sectional area of the nerve is less than 9 millimeters squared, you know, I figure what it is, 99% chance or 98% chance they do not have carpal tunnel syndrome. They have something else. And you can have multiple things. So you could have the nerve compressed at the wrist, at pronator teres, thoracic outlet syndrome, you know, under the clavicle. The nerves can be compressed multiple regions. Maybe you have nerve compression somewhere, plus referred pain from myofascial trigger points. You know, I've solved a lot of people's carpal tunnel syndrome, even people who've had the release, even successful release surgeries. Yeah, my pain went down 20%. They called it a successful release. But yeah, this is the best way. This is better than nerve conduction studies for diagnosing carpal tunnel syndrome. All you have to do is basically measure the size of the nerve. So let's change the setting to nerve. It is, oh shoot. And there it is. So the area is about 6 millimeters squared, which is less than 9 millimeters squared, so I do not have carpal tunnel syndrome. Woohoo! I will say that the Clarius is much easier for this. I can see the nerve right away. The only reason I can even find the nerve in the mess with this transducer is because of anisotropy. The nerve doesn't change as much as the tendons do. So for hip joint effusion, I have this right now. I have my shorts off. So I can get at this, which is why you're not seeing where the transducer is. But I have this neck of the femur, head of the femur, and you basically look for the joint capsule, and you see if the joint capsule basically has fluid in it. And you would measure this, and if the distance between the joint capsule and the femur is larger than 7 millimeters, you could diagnose a joint effusion. Okay, I wanted to briefly show that you could also use this to check for DVTs. So I have this basically at the inguinal ligament, and you look for the Mickey Mouse point. And the idea behind a 2 or 3 point DVT screening is you just do compressions, and if it doesn't compress, that means there's something in the vein. So we do a compression, and the vein did not compress. Now I'm standing right now, which is going to modify the results, but I should repeat this, recumbent, and see if it still is uncompressible, in which case I would diagnose myself with a DVT because I can't collapse this. So a 3 point would be basically at the common femoral, then there's going to be a deep branch that breaks off, so you want to do it just before and just after that branch. Which is just an inch or two down the leg, and then you do behind the knee, basically, the popliteal veins, and then that's it. It's very quick. So I did one compression, so I can slide down, and you can see the vein sort of bifurcating there. It's compressing a little bit better, but still I would diagnose this as a DVT. So here's the popliteal veins behind the knee. And do they compress? Yep, all good. Okay, now we're on to the knee. So let's unfreeze this. And we can see, so this is suprapatellar recess. And I have a tiny itsy bitsy bit of fluid there. It's compressible, so it's not synovitis or synovial hypertrophy, but that's a little bit more than usual. So a little bit of joint effusion. And of course, on top of that, if I freeze, so this is the fluid, the joint effusion a little bit. And on top of that, we have the quadriceps tendon. And I can then go to the patellar tendon and look for any and scan through for any pathology there. Now that looks all normal. I can then go to the MCL. That looks good. Honestly, I find this Chinese ultrasound, for some reason, it's great at knees. Like, I would not, I wouldn't feel like I need to choose the Clarius over this Chinese one for evaluating knees. I think it's just fine. If we want to look at meniscus, so we can see the meniscus there. It sort of tilts back and forth to try to get views of the meniscus, look for a tear. If we get a good view of it there and that meniscus looks fine, we can try to look at the posterior meniscus. I used to have a tear in that meniscus. Yeah, I can almost make out where that tear was. Almost. So next one is the tibialis posterior tendon. This is just right behind the medial malleolus, and this is a common misdiagnosis because that can result in an acquired flat arch or flat foot, and can cause medial arch pain, which a lot of people then get diagnosed with plantar fasciitis, when really the problem is a tear, sometimes a full rupture of the tibialis posterior tendon, and that can be repaired if it's fully torn, for example. So no need for a misdiagnosis. Let's take a look. So there's the tendon. It's against the medial malleolus. It's nice and easy to find, and we can try to see that in long axis. Yeah, we see it in long axis, and I don't see any tears. Great. Perfect. Awesome. Now let's check out the ATFL. So what I'm going to do is I'm going to put my foot in the position where it would cause an ankle sprain, right? Sort of twist it all the way in, and I'll put tension on the ATFL ligament, and we should be able to see that ligament nice and taut. So let me contort my ankle here. I wish I was doing this on someone else and not me. So lateral malleolus. There it is. There it is. And it's intact. Awesome! So here's a parasternal long axis view, and you can see it's quite dark. Left ventricle, left atrium, the aorta. It's just dark. And this is with gain, I think, all turned up. So that's just my comment. Hello. I plan to do a quick eFAST exam. I'm going to explain a little bit, but of course, if you want a detailed explanation, see my full lecture on the topic. I'm going to be using this 3-in-1 Chinese unit, which has a pretty good linear, has an okay curvilinear, and does have a cardiac sector probe function, which is, let's start that eFAST exam. With practice, you should be able to do this in less than 5 minutes. Right, and remember, eFAST, we're looking for fluid because this is a trauma exam. Okay, so we're going to start with lungs, and I'm going to start basically second intercostal space. Change the. I'm actually going to turn this on to M mode. I don't necessarily need M mode, I don't think, and I'll change the depth here a little bit deeper. So you want between the ribs, and you have the patient take a breath, and you look for pleural sliding. Sometimes that's hard to see. So you look at the M mode and you look to see if it's more barcode sign or more seashore sign. What will happen is you're looking for basically ants moving across this line. And we see A lines here. which is a reverberation artifact from the reflection with the pleura and the surface, so they're equidistant to this distance. And you see that in pneumothorax and in normal lungs. If the lungs are wet, if there's fluid in the lungs, we get comet tail artifacts or B lines. And we can get like a giant comet tail artifact would be a confluence B lines. Okay, and next is, we can continue and we can go down a little bit lower and check again. The other day I was doing this and could actually see the fissure moving back and forth. You can see the fissure. Neat. So we can check another location. If I have enough gel here. Okay, and we can take our gel and we can go onto the side. We can look there as well. Okay, that's good there. And I would recommend going sort of to the bottom corner. And I'll try to save some gel here. Yeah. So, get between the ribs here. You can see that the lungs come into view. Right there. Let's freeze that. So this is lung, and this was liver. And if there was fluid in the lungs, if at this costophrenic angle, this pleural space here, we would see a hypoechoic or anechoic sort of triangle of fluid here, basically at the bottom of the diaphragm. But we don't see that. We basically see lung straight to liver. So again, we'd see a anechoic, basically triangle here at the surface of the diaphragm if there was an effusion, if there was fluid there, and we don't. This is called Curtin sign. And we could also look for B lines here, but we don't. We get A lines. This is normal looking lung. A couple skinny B lines are normal, particularly in the elderly. Okay, so I would repeat that on the other side as well. So now the next view is the subcostal or subxiphoid view of the heart. We're again looking for fluid, pericardial fluid. I have it on the cardiac setting here. You can sort of see the probe orientation. Okay. And so we're looking for hypoechoic fluid here and here, pericardial. I actually don't find, particularly on this setting, since I have the options, the cardiac setting I find is perhaps better at looking at the actual chambers. And in particular, if I'm looking at the long axis view, peristernal view, I find that sector probe view or setting on this quite useful. Since I have all three options here, like you learn your equipment. Learn the instrumentation you have access to. The abdomen setting actually will give me a better picture for looking for fluid, I think. So if I unfreeze that, now the depth is too deep. Let's change the depth here. Too shallow. Right. Like, look at that. I can see all around the heart, and I think I could get a bit. The other one was just too dark, the whole thing, but now I can see all sorts of different types of tissue, and I feel like I could get a much better idea about whether there's fluid around the heart or not with the curvilinear setting. If I freeze this, and I'd be looking for a fluid collection here and up here, is where I'd be looking. Now, next, a lot of people, since you're in the area, they rotate the transducer 90 degrees and they look at the inferior vena cava. So this isn't part of the explicit eFAST protocol, but since you're already in the area and you already have the sector probe or the curvilinear probe, and both of those will capture the inferior vena cava quite perfectly, we might as well take a quick look. And there is a reason to look at it in cases of trauma. It does give you some useful information qualitatively, even just with a quick look. So here you can see the transducer orientation here, and I can unfreeze that, and I can get a picture of that. And as I breathe, you should see it sort of compress a little bit. And compressing around 50% with breathing cycles is about normal. In terms of the size, you expect it to be in between about 1.5 to 2.5 centimeters. If it is, let's say, enlarged, and if it doesn't really compress, if it doesn't compress at least about 50%, and it's enlarged and dilated, and when it's dilated, you'll see these lines become more parallel, and sometimes it really doesn't compress at all. That can mean some sort of obstruction, some sort of cardiac pathology. If it is like entirely compressed and it's small and it's very compressed, and if you have trouble finding it, you may look in short axis view, find it, and then rotate the transducer once you have it centered on the transducer. I find that's a useful way of finding structures. You find them in short axis first. When you want a long axis picture, you find them in short axis first and then rotate. In fact, let me do a little example of that. So there it is, and I make sure that's in the center, and then I very carefully rotate, and then it should appear in my long axis. And there we go. Now, of course, as you move around, there we go. There's a perfect picture again. And again, mine compresses just a little bit, which is normal, and it's about the right size. If it's too small, if it is too small, less than that 1.5, or it's completely collapsing all over the place, then that can indicate you don't have enough blood. The person's bleeding out. Bad. So in trauma cases, that's what you're checking. You're checking and you're like, okay, this person's like running out of blood. Like, what's going on? It might be internal bleeding, for example. So now for the perihepatic view. And for the perihepatic view, either curvilinear or sector probe or phased array probe. I use those two terms interchangeably. And if you are using the sector probe, which is the recommended probe, you'd be looking between the ribs. You'll see, for example, here, if I try to put the curvilinear sort of on the ribs, you can see there's so much shadowing from the ribs. Between the 10th to 11th rib is roughly where they recommend you put. And I can see, look, I can see a little bit, so it's not impossible. But I could come, for example, underneath and look upwards, and then I avoid that rib problem. So again, learn your machine, practice, 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 because this is a great view. Look, I can get a good view of the liver and the kidney, and this is the space I'm looking for. This is Murphy's pouch here. So this is a great view, and I would scan through the kidney to see if there's fluid here, and of course you could scan everywhere for fluid. Of course, if you're looking this low, this assumes you've checked the corner of the lung. Because in the eFAST protocol, they're sort of assuming you're checking the corner of the lung, above the diaphragm, and you're checking the Murphy space and, all around the kidney. And you're doing that all from basically the same location. But I already did a lung view, and I already checked the bottom of the lungs with the linear view, so I can just really focus on Murphy's space right now. And I don't necessarily need to check the corner of the lungs because I did that with the linear transducer instead. In which case, for me, as I mentioned, if I'm using curvilinear, I would probably go underneath the lungs so there's no shadowing, and I can just sweep through. If I do switch it to the sector probe, of course, I would be able to see between the lungs. I've mentioned that this 3-in-1, the curvilinear setting is much better than the sector probe setting or option. So the curvilinear is the way to go for me. So I would probably go, again, I have the option, I could go underneath and scan through. Yeah, no fluid around that kidney. And again, I could try to go through the ribs. And you can do it. Again, if I had a sector probe, that's what I would do. And now we're on the perisplenic view. So the other one was perihepatic, right upper quadrant. Now we're in left upper quadrant. And we want to unfreeze it here. And again, oh, those ribs are getting in my way. Again, I can try to sort of go underneath and upwards to try to get a picture of that. And upwards. So there we go. You can look around the kidney to come up higher to get the spleen. We really don't have an option. It's harder to see underneath. Let me try the sector probe setting. Only turns on if you hit cardiac. And I can increase depth here. You see, it's quite dark. It's quite dark, but I can still make out around the edges there, right? No fluid there. No fluid there again. I'll go back to curvilinear. So even between the ribs, I can still get a good idea if there's fluid around the spleen, and I can move around the transducer to try to see the space between. Again, I'd be looking in this space and make sure that there's no fluid there, and I would screen through. It's hurting my shoulder a little bit trying to do this on myself. Of course, you're doing this on someone else, and you sweep through and screen through basically the entire structure. So lastly, we have the pelvic view, or the suprapubic view. So it's way down above the pubic symphysis, and we're going to look in both planes, and we're just going to be screened through. We're looking for fluid, which will be basically around the bladder. So you want whatever settings gives you a good view of the bladder and structures around the bladder. For men, you look for fluid more between the bladder and the rectum. For women, you look for fluid more between the bladder and the uterus. Of course, men aren't going to have a uterus, and you just screen through in both planes. So here, if I find my mouse cursor here, and I unfreeze that, and I'm in, let's say, vertical, and I could screen through. And I don't see a fluid collection. So if I freeze here, just to talk about structures here, right, we have bladder, and then we have rectum here, so I'd be looking around here. Of course, you could find fluid anywhere, but all the fluid, all the anechoic fluid should be inside the bladder. We shouldn't see anechoic fluid around outside the bladder, right? So you're just looking for fluid collections in other locations. And I can rotate this and screen through in the other direction. And I can screen through. And well, you can see the rectum there underneath the bladder, and there's no fluid collection. Okay, that's done. Now, if you prefer, you could do it out in the reverse order than I did, but regardless, just screen through it in both planes, looking for fluid outside of the bladder. And that's it. That's an eFAST exam. So in summary, what are my final thoughts? If I could only get one, which one would I get? This is surprisingly good, and considering this is about, let's round things, this is about $3,000 and this is about $4,000 to $5,000. So you could consider this, I don't know, maybe 50% more. Is this 50% better? For musculoskeletal, maybe it is. I think I can make, like, the knee images, I think I can see everything with the knee that I can see with this. I don't think that there's anything extra I see. Now, for trickier things like the thyroid was so much clearer with this. In terms of the shoulder, I much prefer this. The shoulder can be really, really tricky. So for I'm more comfortable with this for the shoulder. But for other structures, I seem to be okay with this. I've been using this for the past few months, and I think I can make maybe 90 to 95% of my diagnoses with this, and so there's no benefit to having a better one. And if someone wants to get into musculoskeletal ultrasound or point-of-care ultrasound and wants to save $1,000 to get into it, if it's, oh, I can't because I don't have 5,000, I only have 3,000. Well, for 3,000, you can start. I think this is great for an eFAST. Some of the other protocols, like the CLU protocol, that involve checking more things in the heart, I think the cardiac views are very lacking. But checking for pericardial effusion is fine. But just that extra stuff around the heart and taking measurements for the heart, it's just too dark on the cardiac setting. That's my opinion, but I'm not a cardiologist. Maybe it's fine. I think it looks too dark. But for an eFAST, like an emergency, just looking for fluid in the abdomen, pericardial effusion, it's great. DVTs, it's great. It does 90% of what you could want. I feel that I'm only so positive about this because I have experience and because I'm used to looking for these structures. I know what I'm looking for. I know what it's supposed to look like. I think if I was learning with this, I think I might never find the median nerve, for example. But I know where it is, and I know how to sort of tease it out. I know sort of tricks to find it, and so I can find it fairly quickly with the transducer. I do miss the width. The width thing is the one thing I miss, but I can make pretty much everything else about it work for me. But I want to be clear that it isn't perfect. It is not as good as the Clarius for musculoskeletal diagnoses, for subtleties. It is not as good as a cart-based unit. Again, 90% is good. Yeah, sure. Or maybe not 90% is good, but I can make 90% of the diagnoses with it